Greetings, everyone. Good morning to those of you who are in Porto. Thank you for joining us for this morning's keynote address. I'm delighted to introduce our speaker this morning, who is Professor Teresa Leão. Professor Leao is a medical doctor and public health specialist. She earned a PhD in health economics and is a professor on the Faculty of Medicine at the University of Porto. Her research involves several public health topics, with a focus on the impact of health and social policy on the population's health and health equity. The title of her keynote address today is Bridging to Health: Can Libraries Be a Safe Haven in the Midst of a Pandemic? Please join me in welcoming Professor Leao to the virtual podium.
Hi, everyone. I will share my screen if it's possible. Okay, let me just put the full presentation going on. I think it's okay. Can you just confirm it? You can see it?
We see it.
Okay, thanks, Charles. So, hi everyone, and thank you for inviting me to be part of this conference. This conference is from a completely different area from that I'm working now and that I know. I am not a librarian, and I only know libraries from a user perspective. And from a user perspective, I do like libraries a lot. My PhD in public health and in health economics was done mostly in libraries and cafes, and also trains. I did some side job as in a medical school, working in a library from medical school. It's a very small library with about maybe 80 meters square. Now it is changed; it is bigger now. So my library knowledge is quite small. But when I was invited to be part of this conference, why not try to join what I don't know so much from a professional perspective with that I know a little bit more as a professional. As a medical doctor and a public health specialist, I've been following, as you did, all this pandemic and epidemic in Portugal, trying to understand what measures worked, what were the consequences of the measures, and what were the consequences the consequences of COVID. And so I also helped the Porto University to create the contingency plan for the university with all the different settings that it has, from bars to libraries, from dorms to classrooms. So I will try to join these two worlds of the libraries that I know a bit and COVID that I know a bit, and we all know a bit about it. And I will also try to join in this talk what has been the knowledge created by the interest of libraries for the health of the population. Are libraries places that may create health for the population that they serve? So trying to put all of this together, the title of this session is, can libraries, university libraries, public libraries, be a safe haven in the midst of a pandemic? It can be COVID, it can be another one of another infectious disease. I will start by a challenge. Some years ago, Forbes, a writer from Forbes that's afterwards just withdrawn the article, was mentioning maybe public libraries should not exist because we have internet, we have Amazon, and maybe the taxes that go into public libraries could go into financing other ways of doing that. And maybe, I don't know if you thought about that, probably yes, but what if our libraries do not exist? Would it impact the population? Would it impact some groups more strongly? Let me show you two pictures. These two pictures, this one picture and the other that I'll show you after, are from Portugal. I think that maybe in the 60s, and they are related to the mobile libraries that were created by the foundation Gulbenkian. This is a foundation that is based in Lisbon, and they created in the final 50s some libraries in these cars that you can see here that carried books around Lisbon and Lisbon area, giving villages the ability to take some books and to read some books. In that days, Portugal had very high illiteracy rates, had many people who had or no education or only 1 to 3 years of primary education. So it was really an uneducated population. And then this initiative just dispersed and was able to go into all parts of the territory, at least the continental, the mainland, and it went into the interior areas where it snows, and you see that people actually use them. The photographs that they have in the Flickr archives are really beautiful, and you see all these people gathering together to get books, which is, for me, is very poetic. Why do I show you this? I remember these pictures and I remember these mobile libraries when I saw this concept by Klinenberg of social infrastructure. So social infrastructure is different from social capital. Social capital, as you may know, is this idea that the society is connected, trusts each other, helps each other, can somehow help people to protect against adversities or to recover more quickly from adversities. It can work very well in situations of catastrophes to recover more quickly, or just to protect people in their daily lives against trusting people and being able to contact and connect, and creating this more comfortable society. So social infrastructure is a place in which social capital can appear or can be more strongly created. Why? Because it's this place. A place can be a library, can be a park, it can be a school, it can be a playground, or, I don't know, a swimming pool. When people meet, they can meet just to see each other or simply to do their businesses, but they see other people, and sometimes they engage in conversations, some small talks or some more important talks, and they see different points of view, and they just create this empathy among each other. So these places, as these ones that I was showing you, and our libraries, can be social infrastructure places. And Klinenberg really defines that this can he has shown in his works that this can strengthen the population relationships and also protect their health. Other authors some years ago have looked into how social capital do provide or do influence or are associated with the health of the population. And here you can see the different states of the US and the percentage of those who say that trust, they have trust in other people, and those who reflect the poor health. So in this situation, a lower trust. Also, I mean, most people saying that people cannot be trusted can be associated, like looking at these without another adjustment, to a poor health. But these authors, Kawashi among others, looked into individual data, and what they saw is that even after adjusting for sex and age and race and household income and smoking status and obesity and access to health, people who had a higher trust had a lower probability to report a poor self-reported health. So people who had lower trust or lower reciprocity or lower group membership were more able to say, I don't feel well, I don't have a good health or a fair health. And regarding mortality, the same. Again, here in ecological perspective, saying that when we see people, or we have people that respond, that people take advantage of me if they could, are those, or they live in those areas that have higher mortality rates. And looking again into, in this case, in ecological terms, the areas in which mortality is higher are associated with social mistrust or helpfulness. So these can be also gathered in terms of social capital. Another one, and it's last one, I promise, is a more recent one. It was done in Chicago, and they looked into the neighborhood level, about 300 neighborhoods. They looked in neighborhood level and saw that the neighborhoods in which the civic participation was higher, the death rates were lower. Of course, we can think, what are the causes behind this? Is it because I trust the other people? It means that probably the violence will be lower, or differently, violence is lower and then I trust people, and then for that reason my mortality rates are lower, and the stress level is lower and mortality rates are lower. We don't know exactly. These have been explored in the last studies, but I wanted to share with you this idea of social capital, the importance of being connected in society, and the importance that some structures as libraries can have in this situation. So I really like this sentence, that neighborhoods and communities can, of course, flourish or reduce their capacity or flounder the capacity of being available to be happy in terms of social infrastructure. And this social infrastructure, as he was saying in some podcast, is as much important as it is having good roads or having good good structure, other infrastructures that we use in our cities. But of course, these kind of infrastructures are costly, so they have some costs associated. And of course, you can question, okay, should we keep it open? Should we close it? But of course, it also depends on the way we see the importance of those structures to keep the society happy and comfortable and healthy. So as we do create playgrounds, as we do create athletic fields, we also may try to look at libraries as important to our societies and keep investing in them. Why do I tell you that? Because we know that libraries are important, and they are also very important to disaster recovery, as the Kinder Institute for Urban Research says. But coronavirus is keeping them closed in many countries, or kept them closed during many months in many countries, maybe in yours as well. In this case, for disaster recovery, it's very interesting because when disaster occurs and libraries are still open, people can gather inside, be in safe places, go into internet, for example, and use internet to connect to the rest of the family or to the services needed. So it is really a place that can help people to recover, and this has been shown already. But due to COVID, things are different because we cannot have all of these people gathering around the library. So, how can we have our doors open and not open to COVID, or trying to not have too much risk of having transmission of COVID inside? So regarding COVID, but regarding all the other infectious diseases that may occur, we should think of how is it transmitted. That's the first thinking that a medical doctor working in public health will have. Okay, how is it transmitted? What is the probability of being transmitted? How can we reduce this risk? So to be clear about COVID, transmission is done mostly by droplets. Droplets, small portions of water and saliva that has COVID, and that when we talk or we sing or we scream or we cough or we sneeze are sent into the air. I gave you a range of risk of droplet emission. When I'm talking, and of course it changes from people to people, but when I'm talking, the amount of droplets sent is lower than when I'm singing and than when I'm sneezing, for example. So there is this risk. And of course, the risk is lowered when people have the right behaviors of covering by the elbow or using the mask. So and mostly when using the mask and covering, by the way, elbow when they sneeze and not one or the other, of course. So this is the main way of transmission. And when you're thinking about protecting our users, we should think, okay, the first way of transmission is this one, so we should think of protecting them. Another thing that we know is that droplets usually travel around 1 meter. 1 meter and something less, a little bit less in some other people. But that's why we say that 1.5 meters or 2 meters are the recommended distances to keep the physical distance between people. So that's why we keep these distances. Then we have the contact. These droplets can go into our hand when we sneeze, or simply because we just touch in our mouth and we touch another person, they can pass to their hands, and then if they touch their nose or their mouth, it can import the virus, if you want to say it like this. Also, we have the situations in which people touch their nose or their mouth, and then they open the doorknob, or they use the keyboard. And in this situation, of course, we have the surface also with virus. Another situation is that when we emit droplets, they will fall, and they will fall on my keyboard, on my surface of my desk. And in these situations, also we have risk of transmission. So if we want to reduce the risk of transmission, we have to look mostly at these two ways of transmission. By droplets, person to person, by direct contact, of course, and by these surfaces. So it's 3 situations, not 2, as I said. So in these 3 situations, we could reduce the risk hugely of transmission. Also, there is another one that's also mentioned frequently, that is the emission of aerosols. So very, very, very small droplets that can stay in the air for some hours, and that may be inhalated by people and may carry virus with them. But these situations of aerosols are most common in COVID in hospitals. In hospitals, it's a place when people go and they are intubated in ICUs. In these situations, it's where the risk is higher of having aerosols. Usually, when speaking, the risk is lower, of course, of emitting aerosols, and the transmission does not seem to be strongly done by aerosols. It can happen, but it's not the most important. So we can think, okay, we have our spaces, we have our libraries. How can we reduce the risk of having this transmission by droplets, surfaces, and, okay, aerosols if they happen? COVID is a very interesting challenge, because it is a new virus related to others that we knew previously, but the world was faced as being a high-risk disease, infection, and so many measures were taken to reduce it. And you saw individual measures, environmental measures of cleaning things, and also lockdown measures that were very strict. Well, I didn't know any other disease in which they were so strict, except maybe Ebola in Africa. But in these situations, we had a highest level of implementation of measures. So if a new disease happens with this kind of characteristics, if we do these kind of measures, probably we will be able to control it. The only situation, if there is another way of transmission associated that is not only by hands or droplets or surfaces. The thing is, our libraries and our schools and many other services, most of those, were closed during many months due to quarantine measures or lockdown measures. They were, of course, they were very, very efficient or very effective because they reduced the contact between people, and of course, the transmission was lower and the number of deaths were lower. But what we know is that, in one hand, what we use as a background to decide what to close is based on modeling studies that have different assumptions, as the authors say here, and of course, considering the assumptions, of course, they can have great results or bad results. That is the first point that I want to share, that some decisions were made using assumptions that may be very correct, or others that may be less adequate. Another situation is that it is quite difficult to determine what kind of measures are really good to reduce the number of cases and deaths and what combination of measures. But we know that closing everything is, well, probable good to reduce the cases and deaths, except if we have many people sleeping in overcrowded houses, for example, living in overcrowded houses, or if they don't have a house. In these situations, in these communities, it can be more difficult and cases may emerge and may arise. But in the remaining, it is probable that the numbers will lower. However, these measures that are very, very strict of full closure of schools, libraries, etc., have a profound negative impact on individuals. And this is what the WHO says. Of course, in some countries they are needed, but we could try to understand what are the measures that could be more interesting to reduce them. And one thing that I want to stress here also is that measures that are really strict and closing everything would affect more people who live already in disadvantaged group, in disadvantaged conditions. So people who live in more vulnerable conditions. I don't have much information about the risks of transmission in libraries, the risks of existing outbreaks in libraries. We have some evidence about schools. And of course, there are many, many articles about schools, some of those using modeling, others using real data to support the conclusions. When you use modeling, again, it depends on the assumptions that you use. But what we see in these three that used real world data is that transmission in schools usually reflects transmission that occurs in the community that is around. So if we have strong measures implemented of personal protection like masks or distancing or hygiene in the schools that we can do it, and of course having some reasonable thoughts behind it, because they are kids, of course. Still, when we implement some of these measures, the transmission between kids is lower, and it usually reflects what is happening in the community. So, if it happens like this in schools, I will say that in libraries, usually the risk will be even lower because interaction between people is a bit lower than in schools when kids playing around and contacting and hugging each other. But okay, you could say, okay, you were cherry picking and you chose 3 studies that were only supporting this idea that in schools it is safe. But okay, CDC says the same. And also ECDC, the European Center for Disease Control, say exactly the same. They could be useful to reduce the COVID, the transmission in the community, but they should be complemented with other measures. That is the first thing. And the second thing is they appear to be impacted. Transmission seems to be impacted by the community transmission. So the number that is really associated with schools may be quite small. Only 2 studies to show it. These are case control studies. This one was done in France. It will be published now in Lancet Regional Health Europe, I think. And what they saw is that the risk is higher in situations where people gather in private situations, like in a lunch in a family, for example. It's very, very strongly. It was also associated with bars and restaurants in France, but in schools and university, the risk is actually lower than in the rest of the community. So probably because schools and universities implemented good measures and were surveilling the measures and being sure that they were enforced, that were put in place, probably the risk was lower than in the remaining population. In Portugal, we did the same in the area of Lisbon, and this is not published yet. But what we saw is that, okay, remote working protects us against COVID because we don't see each other. And it was very curious because being a student also was associated with a lower risk after we adjusted for sex, age, and citizenship. Going to restaurants also protected us, but maybe because this was compared to being at home and meeting people at home in a more informal situation. So, looking at COVID, the way of transmission, and also giving you an idea of how much time do the virus survive in the different surfaces. And in this situation, it was, for example, looking at cardboard. One of the questions that we had when we were looking to the contingency plan was, okay, can we what do we do with books or with the exams of the students? And in here we see that, well, it is unlikely that virus will survive in paper for more than 24 hours. Why? And in this situation is a very favorable situation where the humidity and temperature was very stable and was good for virus. So in the more adverse situation, it will decrease more quickly. So this is useful for what? For example, if you borrow a book to a student and he gives you back, it can be quarantined for a day, for example, if you think that the risk of transmission by surface could be important. Of course, now with the vaccine, all of this is completely different. And nowadays, we do understand now also that the risk of transmission by surfaces is really, really low. There is a nice study that they did in Italy where they were just trying to search for the virus in different surfaces of the hospital. And it was there in many, many surfaces, but outbreaks were not occurring. So what happens that it was there because someone was sick, but it was not enough to create an outbreak in the hospital, for example. So, can we have a safe place? A library be a safe place, but of course adapting to this new normal that we now all live in? I would say yes, and I will give you some pillars to try to make your libraries as safe as possible, not only for this epidemic, but for others. So first of all, we know that physical distancing is very important for COVID because the transmission is done person to person mostly and by droplets. So if so, one of the things that is very, very interesting is what you're doing now, that is doing webinars, distance webinars. And this actually is a very democratic way of approaching it. People who live in distant places, who will not be part of the faculty, are able to learn with you and to be able to share with you some questions, some doubts, and some ideas. And this, of course, creates interaction between people that are that are really far away one from the others. So this is the first thing. We can keep the connection, but using the new technologies. And now we are all used to it. So it is, for sure, for you, it was an adventure to change it, but it's now working. The second thing is, we also need the physical the presential activity when we need to interact with people, to access to books, to access to archives. So here I would say that it is very important that the users and the workers of the libraries are really aware of the need of physical distancing and the use of masks indoors and outdoors when it's the numbers are high as well, or when the country demands it, to keep the risk low. And the physical distancing, you can think of the tables that you have in your library and be able to have the tables organized in ways that people are not too closer or closer than 1.5 meters or 2 meters. Also, you know that people not usually when they talk to each other, they emit particles in this direction. So you can create different directions in which people the interception will not create the connection with the droplets. Another one, and you know this already, is hygiene. But here for hygiene, I talk about the individual one, the one of the surfaces as well, but also the creation of a context in which people know that they are supposed to have hygiene. I mean, we can ask, for example, people that if they are sick, They do not use your setting or your spaces. And you can also say, okay, you can connect with us by email or using this platform, so you're not alone and you'll not be abandoned because you're sick. But that's something that, at least in Portugal, was very common. People who were sick and they went to work because they're really committed to do a great job. But of course, the rest of the colleagues became also sick. It was very, very common before COVID to happen like this. So first of all, the idea that if I am sick, I'm not going to use the library, or if I get sick, I should go at home and stay at home studying, working, etc. The second thing is, okay, your users should be able to have access to water and soap and towels, paper towels. It was very common previously to see bathrooms without any kind of soap. And of course, this is not logical at all. We know that for cleaning hands, soap is much better than having any kind of alcoholic solution. So we should use the bathrooms, and these should be provided with these kind of situations. Of course, that also those who have access to your spaces can know that in certain places they have alcoholic solutions to clean their hands. And this can be noted, for example. There must be clear that in that point and that point, if they want to, if not, if they feel that their hands are dirty, they can use it. And not only in the entrance, for example. The other thing is about surfaces. Of course, we know that in some surfaces, the virus can be there for some hours, days, so they should be cleaned frequently. And those that are most used, like doorknobs, for example, should be cleaned more frequently. But I would say that not only cleaning them, but allowing the users to have a towel and a cleaning solution to clean it is very important as well. So if I am a client or if I'm a user and I want to use that desk, but I don't feel comfortable because I don't know if anyone else was there previously, I can ask people or know where they are the towels and the cleaning products to clean that area. And I think that, well, giving responsibility and giving the products available can create this safe environment. The third point is ventilation. So aerosols are not so commonly the biggest cause of outbreaks of this infection and this disease. Ventilation is still useful. It's useful to reduce the carbon dioxide that is in the space. Is useful to balance the humidity as well. It is useful to balance the temperature that is in the room. So even though we are not too focused on the aerosols, the ventilation is really, really important. And other diseases are transmitted through aerosols, for example, tuberculosis. So if ventilation works quite well, the risk will be lower. And ventilation can be with a central air conditioning unit, but it can be opening the doors and windows and making the air just flowing from one space to the other. Also, tracking. Some countries did that. I don't know if in Portugal we did that. I don't think so. But you do already track the books. Who borrowed it? Who gave it to you? Who was taking it next? So tracking who gave you the book, who delivered the book on Monday and became sick on Tuesday, and the book was already given to another person on Tuesday. It's very important to be able to say, okay, do not use that book or clean your hands very frequently because the person who had the book previously had COVID. So this can be one thing that you can do. So I'm not too worried about the transmission through surfaces. That's something that you can think even for other diseases and those who may be more, those diseases in which the agents can stay longer in the surfaces, we can think of that in the future. Also tracking the persons who use the spaces. So in some countries it happened that people were asked to say to the restaurants that were there in that day. So before they enter into restaurants, saying, okay, I am this person and I'm staying here from this hour to this hour. This is useful because you can have a student or a user that will stay there in an afternoon studying, for example, and in the next day they will know that they are sick. And to be able to track those who were on the library, it can be useful to know that in that area, these persons were there. Or many persons were in the library, but asking to those by email, okay, if you were in that area, just pay attention to your symptoms, do a test to be sure that you don't have COVID. And the last one, but I really think that this is the most important one, communication. Okay, maybe not most important, but it's really, really needed. People need to know what you're doing. People need to know what is their role there. So communicating, for example, the physical distancing, or not going to the library if sick, or you should clean your desk, or you can clean your desk if you want using these products, first tells them that you are responsible for a safe place. The library is a safe place. It tells them what can be done. So it increases the health literacy. It tells you, okay, I should not go work sick. It's really important. Yes, I knew that, but I just recall that now, so I'm not going. So it changes the way people may behave. And of course, it also shows them what they can do at home. Okay, they use this kind of product to clean this, so I may use it at home as well as if I want, or in my association, or in my business. So this also increases their literacy. So communicating that you're ventilating and the room may be ventilated from this hour to this hour and the windows are open, or the hygiene or the physical distancing can be important. Of course, that now we have the vaccination. And vaccination reduces the need of being super strict in all of these pillars, but I will keep the communication here quite well done, because that's something that we still need to have, still need to have some be careful regarding who is in my bubble, who will I just be and take the mask and be less distant. I should be still quite aware of the hygiene of the things that are most important, like the hands, for example, and sneezing to the elbow, etc. It's really something that I think that should be still stressed in these indoor places. So what about the other pandemics that may occur? WHO in 2018 told us that they were getting ready for the disease X. But we know actually that the countries were not very happily able to think of and to create these contingency plans. But also because they thought that, okay, it will be in the future, we don't know what is, so we think we are prepared. And we only know that we're not prepared when we face the situation. So this X disease, what is this? It's a disease that has a higher transmission rate and has a higher mortality or morbidity rate. So a disease that could impact a high number of persons quite quickly. This is more common when we have a new agent or it changes a bit, like in new variants, or when this agent that does not usually is in this situation, but it appears in this situation, in this country, in this group, or when we have a different way of transmission. For example, imagine that COVID now could be transmitted through water, even though that water that is chlorized. It doesn't happen. It's not usually the chlorine that you put in the water, that our systems put in the water, is enough to kill it. But imagine that it could happen. Of course, it will have more cases, and it could have a higher risk of epidemic and increasing number of deaths. Or, for example, imagine that the vaccines do not work and we became susceptible to the host. I hope not, but it can happen with other diseases that we can become susceptible, or some groups can be susceptible to have the disease. Or some situations in which we became more exposed when, for example, we lift measures too early or too quickly, or don't use the masks, or are in mass gatherings. Of course, there are risks of epidemics, and we hope that these kind of situations do not occur in libraries, for example. So, if we have a new agent, the first thing that I will ask will be, how is it transmitted? Is it a general transmission? Like, for example, Legionnaire's disease that come in the wind with small portions of water in aerosols. And in this situation, some people get sick and will have a small outbreak usually. It can be by water, but in this situation, being in a library will not increase the risk of that. It can be like a new mosquito that appears in the south of France, for example, increases the risk of dengue. But in this situation, having a library is not an increased risk, at least if it is located around a stagnated area of waters, it can be a risk, but it's not so significant. So usually I will be more afraid of diseases that are transmitted human to human as COVID. So as I told you previously, COVID gave us already a good training on new diseases that may occur. And what we did as ventilation, hygiene, physical distancing, is usually, I think it will be probably useful already in new situations in libraries to protect your users. Of course, that in hospitals or managing dead corpses, etc., things can be different, or if you have a different way of transmission. But even in situations where you have fecal oral transmission, like from feces to the hands that are not well cleaned, cleaning hands again is the same pillar, and okay, we should stress that to our users. So I think that these different ways of acting are already useful to think for new diseases, and if we train them to COVID, we'll be able to do that in next years for sure. So now what I'm mostly worried is that people were affected by COVID and died by COVID, and there are families that are dealing with grief. We have people who have long COVID, some symptoms that stay a bit longer, and this is really, really tiring, and this affects them as well. But there are also the side effects of many of the measures that we put in place, like mental health and probably some economic and social difficulties in the future. And these will affect mostly those who are living in vulnerable conditions. And I think that libraries can support people to overcome or to reduce the impact of these situations. This is taken from a blog, from The Conversation, and it says 5 ways school libraries support student well-being. I just took off the student, put people, because it works for everyone. So 1, libraries can be safe spaces. That's what I was saying in the last 20 minutes. We already know how. Cleaning, physical distancing, ventilation, tracking may be useful, and communication. 2nd, they can provide resources for well-being, and that's what you're doing. That's what you do for many years, having good people working in libraries, being happy to work with the users and helping the users to find what they need, sharing books, suggesting books, sharing contents in the internet, making people learn. This way you can contribute for their well-being, and you're already doing that for years, or centuries, actually. You can contribute to help to create these health literacy skills. It can be digital or not, but you can suggest the books, have safe or good shelves with good books for that, create workshops, have sharing the contents on the internet. It can create, this idea of what can I do to be healthier? How can I do it? How can I sustain my behavior for a longer time? Of course, this needs some conversation with the user to know if it works, what they feel about this, but it can be really, really useful. And 4, libraries can support reading for pleasure. And that's what books are done for, most of them, not the academics. And even those, we can just create the idea that we can read for pleasure. And this is a safe activity, actually. It does not create the risk or increases the risk of COVID, usually. So why not, again, giving this space for people to read, to find another story, to live another story in a book. and they can encourage healing through reading. And this has been a tough year, and we know that many people have suffered the loss of others that are the significant ones or the dearest ones. I read this book really recently, and it is a note on grief. There are other books, like from, I think that's Simone de Beauvoir, about the death of her mother. And these are very good books to, first, for those who are not on grief, to know how different people react to different ways of doing it or have different ways of doing it. But all of us are needing to read and to share our experiences through this year because we all have something to have grief on. Those who are students and lost a year of interaction with other peers are really, of course, were highly affected with this. So I think that libraries can be these safe havens, safe places where people can meet, share, find other stories, explore their feelings, their dreams, learn but with safe environments, with safe behaviors. So I hope it was useful. If for any reason you want my email, here it is. I am collaborating recently with the Faculty of Medicine, with the Porto University Research Center for Public Health, and the National Health Council, where I'm an expert also. I'm open to all questions. I hope it was interesting.
Thank you, Professor Leao. This was incredibly interesting and very inspiring, I think, for the members of our conference about ways that we can address some of the issues we know that those we serve are facing and leverage some of the kind of activities we already conduct. And I really hope that we're going to have some good questions in follow-up. I would encourage everyone who's in the audience to think about the presentation and construct a question. We have a unique opportunity here with a public health expert who has given some thought to the potential roles of libraries and created some very interesting ideas. And if you put them into the chat, I will read them for everyone to share. I'm noticing using in the Q&A. Let me just say the Q&A button. And I will note that Viola Voss has posted a blog post that is.
It's the blog post that I was mentioning. Thank you for sharing the link. And the guy who is now talking a lot about social infrastructure is Erin Klinenberg. He's a very interesting speaker. He has I think it's a nice talk on Google. So I do encourage you to look at it. It's really inspiring. I think that it really supports the idea that libraries are needed and that your job is really, really important. I don't know if you have any questions or...
I'm hoping we'll have some questions. I might take advantage of this moment just to ask one. You mentioned, I think, the whole concept of social infrastructure and the ways in which libraries could be supporting the growth of that even during a pandemic was interesting. We've developed online webinars, as you mentioned, and other programming, which have in many libraries been very popular. And I see a connection here that it may have been serving a purpose we didn't really think of in terms of connecting with other people. Do you think this is something where in the future libraries should be thinking of both the physical and the virtual space to support this? Would that be something that contributes to public health?
I do think so. From my experience, let me share with you a short story. This year, with the pandemic, I had online lessons with my students from the first year of medicine. And one thing that I asked them in the beginning was always in each session, how are you? How is it going? What are you feeling about? So I just gave them 5 minutes to share their experience through this year. And in the end, when I asked what they thought about the sessions and about all the unit, they said that they really liked the moments in which they were able to share what they thought of. So they were not planning. They did not think of what they were going to say. They were not advocating for anything. They were just sharing. And I really think that nowadays we need some spaces to share informally or formally. It really depends on if you want to discuss a topic or you just want to create some informal moments. But what Klinenberg says is it's really important to have these spaces where people can just connect or have empathy with or discuss some silly ideas about whatever they want, about football if they want. It's really important because now we're just on the internet, and now in the internet usually the ideas become polarized, and it's very, very easily polarized. And usually the society is not so polarized, so I need to have middle ground for everyone. And this decreases the violence rates, and this decreases the sensation of being isolated and alone and against the others, and decreases the stress levels, and this decreases the risk of having an infarction or of having neoplasm. This has already been studied for many years.
Thank you. Thank you. There was a lot there to think about. We do have another question in the chat from Vicki Grant. I would like to ask about the link between citizen science, patients as co-producers of knowledge, and the additional well-being benefits of this. Could this be added to the list?
Participation in every field is really important, and in health, for sure, it is the most important. We use a lot the expression of patient-centered healthcare or patient-centered service, and usually the patient is not in the center at all. It is the financing or it is the guideline, but not the patient, and this is really important. But even for these community interventions, having the idea of how would, adolescents react to this law or to this program, it's really important to have them. So what usually it's said by behavioral scientists is, okay, let's do some focus groups before. Ask people, what do they feel about it? And even on libraries, you can ask your users, okay, I have this idea, will it work for you or not? So usually you have this it's almost a marketing technique, knowing, okay, what would my client think of? Would it be able to touch a target or not, to convince them or to engage them in these kind of situations? And of course, the world is different, and communities are different, and the groups are different from each other. And sometimes we think that this solution in the UK that worked so well in Cambridge will work super well as well in Ghana or even in Portugal. And it's really important to test it a little bit previously and to be sure, okay, what will the focus group say? What would the user say before you implement it or during the implementation, for sure.
Thank you. I don't know if you've noticed, but you've been getting a lot of likes from several of your responses, and also during the presentation. This most recent one is very strong, and you're receiving thanks in the chat, in the Q&A. I'm hoping there might be another question. This has been such a inventive and provocative set of thoughts about the role of libraries. Maybe I'll take advantage of this moment again with you to ask another one. One of the traits of some traditionally associated with libraries, let me say, is sort of a risk aversion. And I think that what you're suggesting is for us to maybe take a stronger, maybe a more directed and confident approach to our role in society and in a situation in which there are health issues, but using science to guide the way in which we organize our physical facilities and our literacy programs, and think about our potential role in supporting well-being. And it's very inspiring, the kind of ideas you've suggested. And I don't know, I hope that we can maybe find ways to get your thoughts in a very broad access point. Certainly this keynote will have been seen by many people, and maybe we can find ways to promote this thought. And I'm hoping that this is maybe not a question, but it's just an observation, really, that people that are listening have an opportunity to kind of effectuate some of these concepts and build on them. So Thank you for challenging us.
Thank you. The thing is, usually we know our role, but we stay strict to our role. We stay there and we don't go out. And it's not only your fault, it's also our fault from the medical sector, the health sector. Sometimes we forget we have very important community resources that can help us with no extra resources or effort. So this can be really a connection between the public health departments or units you have around, or researchers and you as well. So I think we have to create more links with each other's. You already do a great job, and your job is perfectly adapted. But I think that we need to be aware that these kind of structures are really, really important for the well-being and the health of our society. And I really feel that is passionate. I really feel passionate about that. And I feel that we should be aware of that, even to responsibilize ourselves to create this kind of awareness and engagement with our teams. So I'm aware, I'm available to work with you and those who are listening to. So we have my email, and please contact me if you want to.
Thank you very, very much for that offer. That's very kind. And I think we're nearing the end of our time. And so again, there's a loud applause in the digital space here. I want to thank Professor Leao for the way in which she constructed a presentation that connected to the theme and pushed sort of her to think about libraries in a very focused way. I think she did it quite successfully. So thank you very much. And thank you all for joining. And we look forward to seeing you at our next conference event. Take care, everyone, and stay safe.